video, I'm going to demonstrate how to perform the proper technique for compressions, which is the first part of CPR. Compressions alone can be beneficial for the first 4 minutes of CPR. They are performed in 2-minute intervals without with as little interruptions as possible. After 4 minutes, they would need to be performed with ventilation, at which they would be performed in 30 compressions to 2 breaths. So for this particular dog, there are 4 positions that you can perform compressions. On this dog, I would choose circumferential compressions, which are performed with the dog on its side with the 2 hands interlocked and on the chest. To locate the apex of the chest, we use the tip of the elbow, we bring it back, and that shows the apex of the chest where the heart is most likely to be located. So using your fingers interlocked, you would press down with your palm and using your full body weight over the apex of the chest to put enough pressure to where it would collapse the dog's chest 1/2 to 1/3 performed at 100 to 150 beats per minute, but the faster the better, as long as the chest is fully recoiling after each compression. In this video, I'm going to demonstrate how to determine the heart rate of a dog by using the femoral artery. First, we need to locate the femoral artery by locating the long bone. It's easy to have the dog on the side and using their back hind leg that's on the bottom. So 1 finger length in from the long bone, which runs along the leg, you'll find the location of the femoral artery. So we want to take how many beats you feel in 15 seconds and multiply that by 4 to get beats per minute. So I'm going to start the timer. And I got 20 beats. Multiply that by 4, we get 80 beats per minute. Our normal heart rate for puppies to small dogs is 180 to 220 beats per minute, and for medium to large dogs, 60 to 160 beats per minute. And that is how to locate the femoral artery and assess. In this video, I will be demonstrating how to apply an emergency bandage. The 2 things you want to remember is to not make the bandage too tight, to restrict the blood flow, and 2, not to make a bracelet bandage, which is strictly just putting a bandage around the area of the wound, which would also be restricting the blood flow. So I'm going to start by using gauze pad, which is representing my nonstick pad. And if a wound was here, we would want to put this directly on the wound. All the primary cleaning and the assessment of the wound severity would have been done prior to this point. Then we want to start at the toe and making sure that it's not too tight. Wind all the way up from the toe, making sure that it's loose and that the toes are still warm. And you're going to want to have good scissors when you do this in case you have to cut. And I already have a few pieces pre-cut. Okay, and that is the cotton layer that will also keep the leg warm and clean before and until the dog can get to the vet. Now this is an ACE bandage, but you can also use a vet wrap, which I don't have. Starting again at the toe, you're going to want to make sure that, again, that it's not too tight. Rolling it out before wrapping it around at some points. and going up and past the wound site. And then I have this here. And that is how you apply an emergency bandage.